It's very nice to see you today. My name is Dr. Chill, and I've heard you've been suffering from some flu-like symptoms, is that correct? Okay. Yes, well, we're in the midst of flu season at the moment. There's lots of germs and viruses lingering around in the air. And as you're probably aware, the flu is very contagious. It can be passed on to one another by sneezing, coughing, or just talking, as we are now. So it wouldn't be a surprise if you are suffering from the flu. But today I'm going to run you through some tests just to make sure. Does that sound good to you? Great. Well, like I said, my name is Dr. Chill, and I like to start off my examinations by just asking you a few questions, if that's okay. Good. So, these questions are just some quite basic lifestyle kind of questions, just to get a better grasp of your current living situation, I guess. So, how have you been sleeping recently? Okay, so you've been struggling to sleep a bit. Yes. How many hours do you think you're averaging per night of sleep? Okay. Yes. 6 hours. Great. And have you had any problems breathing recently? Like shortage of breath or struggling to walk without getting tired, that kind of thing? Okay. Yes, just recently, since you've started developing this flu-like symptoms. Yes, that makes a lot of sense. The flu can really tire one person out. It's, not something we all want to catch, that's for sure, but unfortunately the flu is, like I said, very contagious, especially at this time of the year. So, just gonna write that down. Breathing, just a bit of struggle. Okay. And do you work, or do you kind of frequent quite a crowded and busy workplace or area? Okay, so you work in an office kind of space. Okay, thank you. Okay. Office. Great. And do you frequently travel on public transport? Okay, so you're kind of enclosed in quite a small environment at this time of the year. Okay. Yes, that makes sense. Okay. And finally, have you had any problems eating recently? Swallowing your food? Have you had an appetite? Okay, so you've been struggling to kind of find the, the motivation to eat. Yes, indicative of your flu symptoms. Yes, okay. Great. Okay, so that was all the questions I wanted to ask you. I might ask you some more throughout this examination. However, don't worry, because they're not going to be too intrusive, just some very basic questions about your health, etc. like that. Okay? So, first thing I'm going to do is just check your temperature. Just get a bit of a reading. I'm going to put my gloves on, obviously. And yes, we're going to see what kind of temperature you've got. Do you think you have a bit of a high temperature? Yes. Yes, well, it makes sense. The flu virus can lead to a kind of rise in body temperature and lots of little spikes from being cold to being hot, kind of like a fever. So, yeah, I'm sure this reading will be quite high. But again, don't worry because it's to be expected. Okay, let me just program this. Okay, so I need you just to just slowly open your mouth. I'm going to lay this thermometer just underneath your tongue. And yeah, we're going to get a bit of a reading, okay? Okay, so just open up wide. There we go, just laying it gently. Okay. Just getting a good, concise reading from you. That's it. Okay, just relax. Just relax. Okay. Perfect. Okay, so yes, it is showing signs of a raise in body temperature. Again, like I said, nothing unexpected really. It definitely is one of the signs of suffering from the flu. Thank you for being very calm there. Now, I'm going to start this examination properly off now. What I'm going to do first is just check around your lymph nodes, if that's okay. Just around your neck, just kind of looking for kind of any inflammation, any sign of the virus. I've got my gloves on, so if it's okay, can I just rest my hands just gently on your neck, just around your lymph nodes? Great. Okay, if you just want to lift your neck up a bit, that's it. Okay, now just going to have a feel. Just having a feel around. Just having feel around your neck, just seeing if I can see or feel any signs of inflammation. Okay, just having a feel. Perfect. Okay. Great. Thank you. Now, again, if you don't mind, we're going to have a look inside the back of your throat. The flu can lead to a sore throat, kind of inflammation in that general area. Have you been suffering from a sore throat? You have? Okay. Again, that makes perfect sense. I'm going to see if I can see the inflammation just with this medical mirror. I do have some throat spray for you with me now, so after I've done this, I can just spray a bit down there and just help with the kind of painful symptoms that a sore throat can lead. Okay? Okay, so I just need you to, again, open your mouth. Not too wide, just relaxed. I'm just going to have a look. I'm not going to touch you inside, don't worry. I'm just going to have a look for that inflammation, just that's it, just having a look around, just okay, just open your arm down, just yeah, that's it. Okay. Okay. Yes, I can see a bit of inflammation just at the back of your throat, near where your lymph nodes are. So what I'm going to do, unfortunately, with a sore throat, it's just a bit of a waiting game until it goes away. However, I do have some throat spray which I'm just going to spray at the trouble area. I'm going to prescribe you some after this examination as well, if you wish. It does help with the symptoms, okay? So, just going to... This is a very good throat spray that will do the job, okay? Okay, so just open your mouth again. Just gonna spray. That's it. Do you feel that instant kind of relief? Yes, that's good. You're welcome to take some after this examination. If you wish to use it at home, I'd recommend using it about 3 or so times a day. A couple sprays each time. It should help subside the pain you're suffering from. Okay? Great. Okay, so next off, I'm going to just be checking around your eye area. I'm going to be looking out for any kind of puffiness or redness in the iris. Just some symptoms you would expect from having the flu, of course. The flu can lead to a lot of tiredness, a lot of sleepless nights. So I'm just going to have a look around your eye just briefly with my hands, and I'm going to use a medical light just to get a bit of a better look, okay? So just keep your eyes relaxed and open. Just gonna have a look around. Okay. That's it. Just tapping around, just around. Okay. Okay. Just having a look. Okay, perfect. You're doing very well. Just relax. You're in safe Stevie Chill hands. Okay. Okay, perfect. I can do see a bit of redness, which is to be expected, of course. Next thing I'm going to do is just do some follow the pen exercises just to see how well your eyes respond to the movement of this pen, okay? So what I need you to do is just, with your eyes, just follow this pen from side to side, okay? Keep your head still and relaxed. Okay, now just follow the pen. And back to the center. And to the left. And back to the center. And just up and down, up and down. A bit closer, just Okay. Keep your eyes on the pen. Okay. Perfect. Well, now, just gonna use this medical light now just to have a bit of a closer look just at that redness, just to make sure it's connected to your flu and nothing else. It's very good to rule out every possibility. Okay, now just keep your eyes relaxed. Don't worry, you can close them if you want, or blink if you want. Don't keep them closed, of course, that would not be very helpful. So just blink when you want, be relaxed. Let me know if the light's too bright. Just having a look around. Just around. Perfect. That's it. Just around. There we go. Perfect. Just having a look around your eyes to see if I can see anything. Okay, perfect. I'm just having a look around. That's it. Yes, I can see a bit of inflammation. Nothing to be concerned about. It's typically very normal with the flu. Just a bit of redness there. I can prescribe you some eye drops to help with that if you wish. And just a bit of redness there. Your eyes are still very beautiful though, so you have nothing to worry about. Okay, great. Thank you for being so still there. Okay, now I'm going to check your hearing and your ears in general. Obviously, one of the side effects of the flu is it can lead to a lot of congestion in your nose, in your throat, and in your ears. This is because there's a build-up of mucus, which is not very nice. It's not a nice word either, is it? Mucus. Ugh. But like I was saying, you get a build-up of mucus, especially in your ears, which can sometimes lead on to infection. And ear infections are not fun. I don't know if you've had one before, but they're not fun. So I'm going to try and prevent that from happening to you. First off, I'm going to look just with my light into each ear, just get a visual inspection of your ears to make sure I can see no kind of problems, okay? Has your hearing been alright recently? Can you still hear a lot of normal things as you would? Okay, bit of ear popping. Yes, that's to be expected. Okay, alright, I'm going to have a look. I'm going to start off with your left ear actually. Just gonna get in close just to have a look. Okay, just having a look. Okay, Perfect. Okay. Yes. Yes, yes, yes. Okay. Just gonna have just to feel around your earlobe. Seeing if I can feel any abrasions, any lumps. Yes, okay. Okay. Yes. Your ears are quite inflamed. Do you feel like they feel inflamed? Yes. Again, a byproduct of the flu, unfortunately. I'm gonna have a look in your other ear. Just want you to maybe just tilt your head to the left a bit, please. And I'm just gonna get a nice look inside. See if we can see any congestion, any redness, any inflammation. Okay. Okay. That's it. Just having a feel around your ears. Just to make sure that we can feel no kind of inconsistencies, anything to worry about. Okay. Perfect. There we go. Yes. Yes. Yes, again, I can feel and see a bit of redness. I'm hoping that doesn't turn into an infection. I'm sure it won't. However, I am going to apply some ear drops just to help clear your ears out of mucus a bit. Again, I can prescribe you this after this examination. Definitely do recommend it if you're having problems hearing. I'm going to have some tests as well for you in a minute, but I'm going to apply this first, if that's okay. Okay. Just need you to tilt your head to the right a bit. Just gonna apply one drop in there. Okay. And just one little drop in your right ear. Great. Yes, it does feel nice just to clear out that congestion. But yes, like I was saying, just got some quite basic tests for you now, just to test your hearing, just to make sure that it's doing okay. Regardless of whether you got the flu or not, it's good just to check. Okay, so I'm just going to be gently tapping this box around your head. I just need you to close your eyes and just let me know, just on a brief 1 to 10 scale, how well you can hear this box, okay? I'm going to take my gloves off for this, obviously, because tapping with gloves doesn't seem like a very good idea, does it? You want these tests to be reasonably accurate. Okay. Perfect. Now, just close your eyes, please. I'm just going to be tapping just around the general vicinity of your head. That's it. Just listen. Keep those eyes closed. Keep those eyes closed. That's it. Perfect. Perfect. Okay, how well did you hear those tapping sounds then? Okay, so about a 6. That kind of makes sense, I guess. Obviously, it's not going to be 10 out of 10 because of the flu and the congestion inside your ears, but a 6 is good. That's a good result. Now, what I want you to do, again, keeping your eyes closed, I'm just going to be gently moving the lid on this jar from left to right, but not in a sequence, because I want you to let me know what side this sound is coming from. Okay? So please just keep those eyes closed. That's it. Just left or right, okay? There we go. Keep those eyes closed. What side was that sound coming from? Yes, your right side. Great. I don't want to do this too close to your ears because it gets too easy then, so I'm doing these sounds a bit further back. Okay, close those eyes and let me know where this sound is coming from. Open your eyes. What direction, was that coming from? Correct. Now I'm going to do it 2 more times. So just close those eyes and let me know. Okay. Okay, what side was that coming from? Your right again, your left, that is correct. So I'm getting my left and right mixed up. Kind of embarrassing for a doctor. Okay, one more time. Just keep those eyes closed and tell me where the sound is coming from. Okay. Open your eyes. What direction was that sound coming from? You're right. Yep, you are right. No, you are right. It was correct. Okay. So, now, I'm just going to have a feel around your chest. just going to be tapping it very gently and just seeing again if I can feel any kind of inflammation around your chest area. As I said earlier on, you can sometimes struggle to get a good breath when you've got the flu, mainly because of the congestion and the virus taking hold. So I'm just going to have a feel and see if I can find anything, any inconsistencies or anything we need to take a bit more of an in-depth look at, okay? So, put the gloves back on. Just put these on. There we go, just relax. Okay, so just going to have a very gentle feel around your chest, just to have a look. Okay, now please can you just gently just cough out to get the air out your lungs. That's it. Okay, now I'm just gonna have a bit of a feel, tapping it very gently around your lymph nodes again, around your shoulders, around your neckline, just around your chest, just to see if we can feel for any problems, any problems. Okay. Okay. There we go. Just relax. Stay calm. You're doing very well. Okay. Perfect. Okay. Just breathe easy. Just breathe easy. Stay relaxed. That's it. Tap, tap. Tap, tap. Tap, tap. Tap, tap. Tap, tap. Great. Yes, I can't feel any problems. Your chest, is a bit tight, but again, it is a unfortunate side effect of having influenza. It is not a very enjoyable virus to have, but unfortunately you are suffering from it at the moment. But the good news is it's just a flu. The flu will go eventually, hopefully within a week, maybe 2. But I will prescribe you some medicine just to help with those symptoms and help you get on during the day. I do recommend resting up low, getting as much sleep as you can, and also hydrate yourself. Make sure you're drinking a lot of water, 3 or 4 litres a day if you can, but 2 would suffice. It's about replacing the fluid you lose from sweating it out by having the flu. So eat, sleep, rest and drink, and you should be fine. It's been very nice to see you today, and if you have any other problems in the future, don't hesitate to let me know. I'll see you around.